All right, so I'm here at Croakey Go on the Yindyamarra Sculpture Walk in Albury with Greens councillor and Deputy Mayor Amanda Cohn. So Amanda's an interesting character because she's not only the Deputy Mayor, she's also a resident doctor in the AED. And correct me if I'm wrong, but you're quite passionate about rural health.
Absolutely.
And yeah, so I'd like to hear, I guess, from you about how your medicine and politics intersects and why you think that, I guess, health and politics, how can they go hand in hand? Or why should they?
Yeah, in my daily experience, they're absolutely connected. And I think that especially working in a public emergency department, so many of the big issues that affect my patients are not their medical issues, it's their social environment and social background that affects their medical problems. So, from obvious things like family and domestic violence, domestic assaults, to people from really remote areas whose problems have escalated that might not have had they been able to receive the kind of specialist care that they do in the cities, people involved in traffic accidents or cycling accidents. There's so many things that are actually preventable by working on the way that we build our cities and our built environment, and also addressing social issues and poverty and disadvantage.
So how does your medical work inform your political work, and vice versa? Does it work the other way too?
I think my medical work informs my political work because it gives me a grounding in the real day-to-day experiences of people in my community. In the emergency department, you get really an enormous cross-section of patients, and it's really representative of my community here in Albury. So I get to meet new people every day at work. I get to hear quite intimate details of their lives. It's a real privilege as their doctor that I think that people share things with you that they might not otherwise. And having that kind of insight is so important in informing the work that I do at City Council, trying to work on the way that we build our community.
And how about the other way? Does your politics inform your health work?
I suppose having an awareness of social determinants of health is so important. A lot of the time emergency medicine unfortunately can fall into being a band-aid, and part of that is, overwhelming resourcing issues and that sort of thing. But it helps to understand where patients have come from and why they've resulted in having a certain problem. So you're not just fixing that problem and discharging them straight out. You're actually trying to look at ways that it can be prevented from happening again, or what kind of other services you can link them into, preventive services, outpatient services. So having awareness of everything else that happens in the community, I suppose, and the other things affecting my patient, I hope makes me a better doctor as well.
What are some of those social determinants that you see sort of time and time again in your work that are affecting people?
I think the really obvious thing is in mental health and drug and alcohol. I think those are issues that overwhelmingly affect disadvantaged communities, so people with lower socioeconomic status or lower educational standards. I often see people with drug and alcohol issues are often self-medicating other kinds of issues, whether that's trauma they've experienced as a child, whether that's an undiagnosed mental health issue, whether that's relationship issues or dysfunction at home, whether it's a result of underemployment or discrimination for certain minority groups. And if you just address the issue on the day, as in, the accident they've had because they were intoxicated or the overdose that they've taken, it misses a lot of those wider issues affecting that person that have sort of caused them to come in.
So it's opportunities, in a sense, to address broader things.
Yeah.
Or it presents an opportunity, perhaps you can't always
capitalise
on it.
You can't always act on it in ED, which is really hard, but I suppose it gives me that inspiration to try and address those things in my work outside of the hospital.
So yeah, we talked this morning, I guess, when we went around the circle about what everyone's sort of the health issue that was kind of on people's minds, and for you it was domestic and family violence. Absolutely. And that's a thing that you're really passionate about. So tell me a bit about what you're doing out here in that yes, I'm going to say context.
So I'm the chair of the Albury Family and Domestic Violence Committee, which is a really fantastic umbrella group of people who work in this space, and it's incredibly diverse. So family and domestic violence is often siloed into either a health issue or a legal issue or a relationship issue, and it affects all of those things, and the solution has to come from the whole of the community. So this committee that I chair brings together police, it brings together housing and tenancy advice, it brings together family lawyers, it brings together doctors, social workers, mental health workers, all together into one space so that we can share information with each other and actually work on the kind of whole of community solutions that we need. And I think one of the reasons that I'm fascinated by and passionate about domestic violence as a problem is that it doesn't just have a single health solution. And unless we have that sort of wider approach, it's never going to get any better.
How long has this group been running?
So this group's existed for years. I was only elected as the chair last year. And it's really gone from strength to strength. I think initially people were just surprised to find out what each other's roles are and actually share that information. And we've grown to a place now where hopefully we can start doing some really powerful advocacy. For example, with our minds combined, we can identify what services we have in Albury and what things we do really well at a local level, and then identify what the gaps are, what our collective gaps are, and what else needs to be done by other levels of government or other services that we need to catch people. And
you talked about, I guess, a bit of a culture shift as well, away from competing with each other for resources or attention.
Yeah, so a really sad reality of funding in the family and domestic violence space is it's often individual grants or short-term projects, and so community groups who are doing really excellent work unfortunately compete against each other for grant funding, and then have to work on these specific projects in isolation, where really we work most powerfully when we work together.
And what are some of your other passions as a councillor?
Yeah, so the other thing I do a lot of work on is urban design and the way that we build our cities. So as a doctor, you can tell a patient until you run out of air about the need to do exercise and eat well and that sort of thing. And we actually need to build our environments in a way that makes those sorts of things easy. If it's cheap and easy and accessible to ride a bike to work, people will choose that. You just need to look at well-designed Northern European cities like Copenhagen to see the effect that it has. So I'm really passionate about making sure we have footpaths and bike paths that are safe for kids to use, that are off the road, that parents feel happy about. Things like addressing pollution in the environment, making sure we have clean water and clean air and places to go into open space, that not only affects our physical health but our mental well-being as well. So in terms of planning and development at City Council, I think there's so much of health that's entwined in the way that we build our cities.
And this walk is absolutely beautiful too.
Thank you.
Yeah.
So this is a perfect example of something I think we've done really well. This is a free, public, accessible space that's beautiful, that people locally can use on a regular basis. It's right close to town.
And can connect with the local Indigenous culture and heritage and be aware of.
For our Indigenous community, it's been a way for them to express, I suppose, their connection to country through the artwork that we have along the trail, and connect to the wider community as well. It's done a lot of awareness raising, I suppose, people in the wider community who don't know a lot about Wiradjuri culture to come along and read about the sculpture.
And how do you think it's different versus, say, working in the position that you would be, like on a council in the city? I mean, what are some of the things that are hard about working somewhere like out here, and what are some of the things that you think are sort of unique opportunities?
Okay. You mean at a council level?
Yeah.
Yeah. I think it goes both ways. Albury Wodonga is a really incredible community in terms of looking out for each other and having that sense of place and that sense of pride in community. So the first thing I thought of when you asked was actually not the problem, it's the blessings. I think that people are invested in the place that they live, and they want it to be a better place for their children. And I think in big cities, people aren't necessarily as invested in their suburb. They move around a lot. They don't have that sense of place that we do here, and that sense of pride in wanting to improve it. Unfortunately, we're a little bit isolated, particularly on the border. The big funders in state government and federal government who are in capital cities don't always understand the realities of what life is like out here or our context. Because we're right on the border with Victoria, we're sort of ignored by the state government sometimes, which can be extremely frustrating. And I suppose just that level of input or expertise, we don't always have the same opportunities for dialogue that you might have with neighbouring councils or with experts, but technology is also a really empowering means to address that. So I suppose I'm lucky to be doing this job in 2018.
Yeah, that's right. And just finally, what is it about rural health that sort of speaks to you?
Rural health is so important because I think that health is a fundamental human right, and it makes me really angry and upset that what postcode you have can affect your health outcomes in this country. And I dream of a world where not only postcode but all other kinds of inequity can be addressed, but I think that's a relatively straightforward one.
Yep.
And we can do a lot better.
Well, it sounds like rural health is a way for you to combine like your two passions in a way, you know, being political and affecting change, but also being very deeply involved in people's lives.
Yeah, absolutely, and trying to be an advocate for my patients.
Yeah. All right. Thanks for speaking with us.
Yeah, my pleasure.